All right, welcome. This is actually an exciting video. It is the first video on Hope Corps' new community health worker training and certification program, which will probably become a separate division of Hope Corps. And we put this up on the YouTube channel. It will be the first of a number of videos focusing on our new community health worker education training and certification arm. This is a new program for us. It's been in the works in the planning for about 8 months. It's being rolled out now because of the COVID-19 epidemic. If it hadn't been for COVID-19, I would have probably waited and not rolled this out until the end of the summer or at the end of the year. But since all our other core programs at Hope Corps are basically put on hold by the government and the COVID-19 epidemic, this is the perfect time to start our community health worker training certification program. I want to make clear that the core Hope Corps programs that we were doing prior to COVID-19 will still continue when COVID-19 ends. That will not change, and I will refer to those as our core programs. They will continue. This will be then offered on as an addition. And the plan here is to initially train all 1,000 community health workers in our county and then offer this training to other counties within Kenya, getting foundation backing to do it, as well as partnership with the Ministry of Health, and then moving on possibly to roll this out to any country in East Africa that has a significant group of community health workers and is looking for training. So let's do an overview, and then in future presentations I'll go over these one by one. But the overview is this. We are going to take on, in partnership with the Ministry of Health, all 1,000 community health workers in Tharaka Nithi. Now initially we are not going to do Tharaka North and Tharaka South, so we will do only 4 of the sub-counties. The reason is Tharaka North and South present difficult problems as far as logistic, bad roads, time of access, as far as long driving time. So we will roll this out to the first 4 sub-counties, and then after that, after we have that pinned down, then we will decide how to approach Tharaka South and Tharaka North. But for the moment, let's use the number 1,000 because the numbers work out easier that way, and we eventually will do all of the community health workers in Tharaka Nithi. So our plan then is we start with community health volunteers, which I'm going to call community health workers. There's 1,000. We are then going to choose, in a manner that I'll discuss in another video, 50 of those of the best of the community health volunteers, community health workers, to be supervisors, so that we'll end up with 50 community health worker supervisors, and each one of those supervisors will be responsible for 20 community health workers. And what we're doing is moving to a trainer of trainer models. We will then focus our training on the 50 community health worker supervisors and have them actually train, monitor, and certify the community health workers under them. And let me make, this is one of the changes that I have made in our program. Initially, as you know, in January, we trained 200 of our own community health workers in a 5-day training. And it really went quite well, and I was quite impressed with it. But when I actually ran the numbers out, it became obvious that the cost of that 5-day training, if you take that out and extrapolate it to 1,000 community health workers in our county, it would be way too expensive. No foundation is going to fund that, and it would be impossible for Hope Corps to fund it. So what I've done is created a very efficient, medically efficient, but also cost-efficient way to train our 1,000 community health workers. So I'm moving away from the mass multi-day meeting that we did in January to another more cost-efficient manner. So it's not that that was bad, it was just that it's not fundable. And if it's not fundable, there's no reason to do it. And again, the strength of 20 years of Hope Corps is we've always learned by our past experiences and continued to improve our programs. So we've moved now to a trainer of trainer mode. So instead of training each of our community health workers like we did in January, now we're going to focus on training 50, hopefully really motivated movers of community health workers that will be willing to become community health worker supervisor. They will be given an increase of salary. Their job will be to take the training we give to them and to bring it to their 20 community health workers. It will also be their job to follow those 20 community health workers in their own neighborhood as each of those community health workers goes to their designated 50 households. So they will monitor their community health workers, and they will also then certify them as we go through the different, what we're going to call flip chart campaigns, which I will discuss in a second. So they're going to train, they're going to in the field monitor, they're going to eventually certify for us, and they're going to be responsible for data collection. So their 20 community health workers will collect data, and they will feed that data to the supervisor, and the supervisor will feed it on to HopeCore. So again, we're going to minimize the amount of direct contact with the community health worker in the field. This will streamline things and make it more efficient. They will get an increased salary to do this as an incentive, and we will talk about that. And one of the keys that we're going to have to focus on in the next month is having our nursing teams and our experienced people go into the field and evaluate the community health workers to find the ones that have charisma, the ones that are motivated, the ones that seem to be intelligent, that maybe even have a background in this and are interested in doing this seriously. So the other thing so we're moving then from a multi-day training directly to our community health workers, to a trainer of trainer mode where we train only 50 community health worker supervisors, but we will probably have a one-day training for them every month. So one day every month, but it will be in their area, so there won't be a lot of long transportation involved. So that's the first thing that's different from what we did in January. And the second thing that's different is we're going to use a different curriculum to train our community health workers. We are going to build off of all the wonderful videos and work that you did in January, but we're going to move to a campaign, a focused health condition campaign flip chart program instead. And what does this mean? Well, it started already with the COVID-19 flip chart, which we're trying to get into the hands of at least 700 community health workers and get them to take that to all 50 of their households. If we accomplish that, then we get into, which I would like to accomplish in the next month. If each one of those has 50 households, that means we have gotten to 35,000 households. And if we use 5 as a number per household, you see how many people we reach. If we use the number 1,000 community health workers in all of the county with our future campaigns, and each have 50 families, that means there are 50,000 families that can be reached every month is what our goal is going to be. And then if you multiply 50 households times 5 persons per household, you get 250,000 people educated on a medical topic over a 4-week period. That's extremely powerful, and it's also extremely fundable when I have to go out and go to foundations to get money to run this. So that's going to be extremely important. So why flip charts? Why are we changing our curriculum? And the reason is that we've had 30 to 40 years of history of community health worker programs around the world. And one thing that's been shown, that the most effective programs have very practical and task-orientated focus to their community health worker program, so that the community health worker in any one month understands exactly what her or his function is going to be on that month. And the flip chart then, what it does 2 things. One, it takes the most important points of whatever we're talking about. In this case, in this month, it's COVID-19, and it puts them in a summary fashion on a few pieces of laminated paper that can be brought into the field and can be flipped, and it allows them to be sure that the community health worker goes over all the main points with their clients in their homes. The other thing that it's going to work for us is that it's a very cheap way of educating and certifying community health workers, because after the community health worker has gone through 20 of the COVID-19 flip charts over and over again in the households, they will know that like the back of their hand. Then over the year, if we have 10 campaigns where every month we're focusing on a new item plus picking up and repeating the most important thing of prior items, what you will have is that all the main topics that our community health workers need to know will be covered. And because of all the repetition with the flip charts, they will know those subjects again like the back of their hand, and they can then be checked off on those 10 presentations, and if the supervisor feels they've done a good job, then they will receive their level 1 certification at the end of the year. So this is really important. Now, what are going to be, let me give you an example of what are going to be the 10 campaigns in a year. The first one obviously is COVID-19, and that's going on. The next one would follow in 4 to 6 weeks, would be basically a WaterGuard soap latrine wash flip chart, which would focus on the importance of using WaterGuard in the home, safeguarding drinking water, using soap with hand washing, and also reviewing the basic latrine within the household. Another one then would be focusing on immunizations for their children, vitamin A, supplementation, and deworming. So those three kind of go together, because immunizations we want to be sure that they have and are up to date on, and if not, we will help them get up to date on, and we also want to deliver to them vitamin A in the under 5s and also deworming. That's going to be very important, because in that, I think we're going to try to get our community health workers to actually bring the vitamin A in the field as well as the deworming, and keep the records and give those to the clients directly. And that we'll have to talk about in another lecture. Then a fourth flip chart will be on prenatal care, and will be particularly focused on young mothers or pregnant mothers to let them know what they need to do if they're pregnant, and what they need to do as far as healthcare follow-up, nutrition, prenatal vitamins, follow-up as far as blood pressure, danger signs, etc. So that's another flip chart that will be offered. Another the disease-specific flip charts, there will be one on a campaign on malaria, focusing on bed nets and the danger signs of malaria and what treatments are available. Another flip chart campaign will be on diarrhea in children, focusing on prevention, danger signs, and how to make oral rehydration therapy in the home, how to either use it in packets or make their own. So that'll be another flip chart. Another flip chart and campaign will be on breastfeeding, child spacing, family planning. Another flip chart will be focused on pneumonia in children, particularly the danger signs and also the danger of tuberculosis, both in adults, and how that can be passed to children. So pneumonia and tuberculosis will be another one. And the 9th flip chart will be on general nutrition. And the 10th will be on what I'm calling local health resources. So be sure that our people, that flip chart will focus on national health insurance, how you get involved, how that helps you, what are the local clinics, what are the local hospitals that we suggest you use, and maybe most important of all, that we push the Hope Corps Health Hotline, which we're going to do in all of the flip chart campaigns to let people know that they do have backup, and both the community health workers will have access to a 24-hour health line at Hope Corps, so that we can give them advice if they find difficult problems in the field, and that clients can do the same thing. So though that would be a year then of community health worker education. And after each one of those campaigns, which will last about a month each, then their supervisor will check them off to say that they have successfully completed that particular flip charting campaign. And after they get all 10 of those signed off by their supervisor, then they will get their 1 year level 1 certification as a community health worker. We will be probably training our 50 community health supervisors once a month as we have to train them for the new campaign. We're going to have to obviously produce the flip charts. The first year, the work is going to be the most difficult because we're going to have to be producing these flip charts from scratch. But you can see what happens. Once we have all this together, it's so easy to roll this out nationwide and even to other countries because we'll have the flip chart, we'll have the educational presentations, we'll have the bugs worked out of the program, we'll be able to do this. Tharaka North and Tharaka South. That is still an issue on how we're going to deal with that. And so what I'd prefer is not to discuss this now. We'll discuss it at a later lecture. We will probably not roll this program out to Tharaka North and Tharaka South until we finish the other 4 sub-counties in Tharaka Nithi, because by then we will really know how to do it, and then we will work out what's the most cost-efficient way to deal with the problems with bad roads and very remoteness of Tharaka North and Tharaka South. So this is the end of part 1 of Hope Corps' new Community Health Worker Training and Certification Program. There will be other parts to this. I'm going to put this on our YouTube channel, and I look forward to revisiting this particular presentation in 1 year from basically today and see the progress we've made. You guys have done such a wonderful job for me in what you did in January. I know that you'll be able to do this, and this is going to have a great future for Hope Corps. I will go out and work hard to fund it. Our goal is to roll it out to the county, then to roll it out to the national, at the national level, and within a couple years, I want this ready to be rolled out to any country in East Africa that has a significant community health worker program. All right, thank you, and I will be back for another presentation as we go into more detail.